Some new numbers show Alabama's infant mortality rate improved by 0.7% last year. The state officials warn there's still a lot of work to be done. WAAY 31's Paige Meyer joins us now live after speaking with the Alabama Department of Public Health. And Paige, what did you learn about this important topic?
Demetria, in 2024, nearly 58,000 babies were born here in Alabama, but more than 400 of them didn't make it to their first birthday. Now, state experts tell me these numbers are slightly improving, but Alabama's infant mortality rate still remains higher than the national average.
Lack of education, lack of resources, I think is our biggest problem.
The Alabama Department of Public Health's Prenatal Division Assistant Director says the three leading causes of infant deaths were birth defects, prematurity, and bacterial sepsis. Specifically, sudden infant death syndrome still tops the list.
SIDS is the sudden and unexplained death of a baby under 1 year of age. Typically, it occurs between 1 and 4 months and can go up to 6 months.
Both Black and white infant mortality rates improved in 2024, but Black mortality rates still remain double those of white babies. She says a lot of this has to do with families' socioeconomic challenges.
I think there's racial and ethnic, minority groups that they just sometimes, Alabama is such a rural state, and they live in those areas where there's just fewer resources.
McAfee says they're working to educate mothers across the state about the resources available to them. She says being intentional about supporting maternal and infant health will ultimately help lower infant mortality rates.
We see gestational diabetes, pregnancy-induced hypertension, and then obesity is such an issue here in our state as a whole. So just that overall health of the mom, she needs to be healthy going into a pregnancy.
For more details and resources available to you and your loved ones, you can open up this story on your WAAY 31 News app. Reporting live, Paige Meyer, WAAY 31 News.